we are at a crucial juncture for external assistance for health. There's simply not enough money for health to achieve universal health coverage and the health-related sustainable development goals, and domestic fiscal space in low and middle-income countries is increasingly challenged by the social and economic consequences of COVID-19, increasing global conflict, and the need for greater climate finance. External assistance for health is itself in transition. In most countries, it's just not that important. Only about 1.5% of health spending in countries eligible for overseas development assistance is sourced externally. The commitments of Paris and Accra so many years ago have not been sufficiently realized, leading to increasing critiques of the way external assistance is delivered and its lack of alignment to national leadership and plans. After a 20-year period of growth, total external financing for health is stagnating or decreasing. There are real questions as to what will happen after the 2030 SDG deadline and the enthusiasm from traditional donors to continue health ODA at current levels, especially given that G7 economies' share of global GDP is about half what it was when the 0.7% ODA target was set in the 1970s. At the same time, emerging powers are not yet showing interest in substituting for G7 financing, or prefer different modalities around loans in their private sectors. While ODA plays a diminishing role in health financing in most countries, there are a group of countries mostly beset by conflict and other emergencies where ODA remains crucial and who have no hope of achieving the SDGs without increased ODA. In this context, the discussions today are highly relevant given it is essential that whatever external assistance for health is available, that it is used in the most equitable, efficient, and sustainable manner possible, driven by country leadership, which of course begs the question of which interests from countries should be met. The lessons from countries that have undergone transition need to be heeded in doing so, including successful practices on what to fund and how to transition,